this is Dr. Prakash from Daikon Hospital, Bangalore. So this is Dr. Anjana RM, Managing Director and Diabetologist, Dr. Mohan's Diabetes Speciality Center, Vice President, Madras Diabetes Research Foundation, Chennai. So today is your topic is burden of diabetes, lessons from ICMR INDIAB study. So here is a question for you, madam. What is the most striking from this data?
So thank you so much, Dr. Prakash. Thank you for having me here. The ICMR India Diabetes Study, or INDIAB study for short, is a national study on metabolic NCDs in India, with more than 130,000 individuals, truly representative of India's 1.44 billion individuals. This is funded by the Indian Council of Medical Research and Department of Health Research, Government of India. So what we found is that we see the burden of metabolic NCDs across the country is extremely high. So diabetes is at 101 million, prediabetes is even higher at 136 million, and if you look at hypertension and obesity, we're now talking about 250, 350 million people with diabetes. So huge burden of disease in the country. Now, if you look at, okay, there's so much of diabetes, do we have all, everybody's A1C under control? Is A1C under 7, BP under 140/90, do we have LDL cholesterol under control? We have very few people with all of this under control. About 35% of people have their HbA1cs under good control. About 50% of people have their blood pressure, and about 60% have their cholesterol under control. So net, if you see how many people have all three under control, it's 7.7%. So only 8% of people have all A, B, C factors under control. Naturally, this will lead to microvascular complications. So we have incidence or prevalence of impaired kidney function. If you just take GFR to define this, you'll see that this is increasing, especially, and one of the prominent things that we found in the study is that we always know that kidney, hypertension, salt, that pathway is what we are taught in medicine. But from the study, we are now showing that diabetes is a more important risk factor for CKD, DKD, even more than hypertension. Of course, the combination is of course the worst. So these are important findings from the study, and they have a lot of implications in terms of control and management.
Thank you. That was a wonderful response. And here is a second question. How do we tackle asymptomatic nature of the disease?
So I think that's very, very important as far as diabetes is concerned, because most people, by the time they have symptoms, it's way too late. And I think screening is the most important thing for tackling the disease. Knowing about the risk factors are very important. So from the INDIAB, we show data on physical activity. We have dietary data, and we've just had a publication that's come in Nature Medicine, about which also I'll be talking, where we show that Asian Indians, 62% of everything they eat is carbohydrate. And do we have enough protein? No, we don't. So just substituting, and often people ask, can we substitute rice with wheat? Wheat is healthy, can we substitute? It doesn't help in India to substitute one carbohydrate for the other. Correct. So you have to substitute carbohydrate with something else. So what do you substitute? You can substitute with protein. Plant protein is supposed to be the best. Dairy protein, which there's a lot of controversy about, that is also quite good. Combination of these two is synergistic. If you prefer animal protein, then fish is the best. Eggs are good. Chicken is null effect. Red meat are all showing risk. So this is for diabetes, prediabetes, and obesity. Similarly, physical activity is something that we say simplistically to understand, say 10,000 steps a day. But getting in a physical activity, 300 minutes of moderate to vigorous intensity activity a week is part of the recommendation. So if you keep doing these, maintaining a healthy diet, being aware, and screening regularly, I think you can prevent a lot of metabolic disease.
Thank you very much, ma'am. Thank you very much.
Thank you so much.